Hi everyone, my name is Lindsay. This is my final semester of this course and of grad school. My topic will be on wound management in wild great apes. The first semester that I took of current issues, my topic was threats to the Florida manatee, and the second semester was the impact of snares on chimpanzees and conservation efforts. So for my introduction, we are mainly going to focus on an orangutan study. I will just very briefly mention a chimp study as kind of a comparison. During her research in the 1960s, Dr. Jane Goodall first noticed whole leaves in chimp feces. This is now known as whole leaf swallowing. So we've really only known that chimps swallow leaves for the past 60-ish years, give or take. And this is kind of relevant because we're going to talk about leaves in a little bit. And then, why should we care about this? There's 3 different orangutan species. All of them are critically endangered. Additionally, chimps are endangered. And then the more that we study and do research on chimps, the more we can learn about them. And I'm going to talk about a fairly new orangutan study that was kind of a breakthrough almost. And then some of the implications, we've known that chimps use tools and other great apes. The study that I'm going to talk about is a good example of tool use. And all great apes are highly intelligent. And this is the first time that we've ever been able to document an orangutan using a plant to treat a wound. So I'm going to be focusing on this Laumer et al. 2024 study. It was published just last year. This study was extremely exciting, especially for someone like me who is a nurse. I don't practice anymore. I worked in the ER in home health, and one of my areas of expertise was wound care. So when I heard about this study, I was very intrigued. The study was so exciting and so groundbreaking because it was the first study to document wound treatment with a plant in an orangutan, or an orangutan using a plant to treat a wound. The study site was located in Indonesia, specifically in the Laumer National Park. The study area consisted mainly of peat swamp forest. There was one study subject. He is a wild male Sumatran orangutan named Rakus. He was born in the late 1980s, and he either lives in the area or he frequently visits the area, and he's been a fully flanged male since August of 2021. This was a purely observational study. There was no interaction with Rakus or any of the other orangutans. The data collection process starts, this is how the researchers defined it, starts when the researchers either find an orangutan or after the orangutan leaves their night nest, which is typically in the morning, until the orangutan builds their new night nest, which usually happens in the evening. And data was collected every 2 minutes. And I know I might get questions on this. Yes, orangutans do build a new night nest every day, and they also have day nests as well. All right, so this slide is taken directly from the Laumer et al. Study. This is the photos that they took of the wound and the slow progression of basically it healing, and then at the very end it being fully healed. It starts on June 22nd, And as you can see, Rakus has a wound under his right eye. Rakus's wound was first noticed on July 22nd, which is the date of the first picture. On July 25th, Rakus was observed chewing on, I'm not sure I can pronounce these leaves. We're going to talk about it in the next slide. Fibroria tinctoria leaves. And he was also visualized topically applying the plant juice from his mouth to his facial wound using his finger. This behavior occurred several times and lasted 7 minutes. Not long after the application of the plant juice to his wound, researchers noticed some kind of flying insects around the wound. They weren't able to identify the insect, unfortunately. Rakus then chewed a leaf and applied the plant pulp to the entire wound bed, and thus this prevented flying insects around the wound. At no point during this observational study did the researchers see any signs or symptoms of infection in Rakus's wound. Rakus rested over 50% of the day when he first developed the wound compared to when the wound was completely healed. By June 30th, the wound bed was closed, which is different than a wound being fully healed. When the wound bed closes, it is still very vulnerable to being reopened. So by June 30th, the wound bed was closed, and by August 5th, you'll see it's the last photo, the wound was completely healed and there's very minimal scarring to where the wound was. And you can just kind of go through and look at the progression. If you look at June 30th, you'll see that the wound is not as large as when they first noticed it on June 22nd. So what leaf was Rakus chewing on? The leaves, like I mentioned in the last slide, the scientific name is up on the screen. I'll try to pronounce it. Fibroria tinctoria leaves. You can see in the photo that I've attached, on the left side is a photo of the leaves, and on the right side you can see that Rakus is chewing on the leaf and he's also holding a branch with the leaves on it. These leaves have analgesic and antipyretic effects. Analgesic meaning pain relief, and antipyretic is just fever reducing. The leaves contain farandipinoid compounds, which may have antibacterial, antifungal, anti-inflammatory, antioxidant, and anti-carcinogenic properties. Additionally, these leaves are known to have protoberberine alkaloids, which might have some anti-inflammatory, analgesic, narcotic, anti-hemorrhagic, anti-ulcer, and muscle relaxant properties, among many other properties. The leaves and stems of this plant might actually inhibit several different strains of bacteria. The one that I wanted to point out was Staphylococcus, but also like E. coli and Bacillus cereus as well. So some strengths and limitations of the Laumer et al. Study. Some of the strengths were that it provided an in-depth behavioral analysis of Rakus's behavior prior to, during, and after the wound treatment. The pharmacological analysis of the plant species helps us explain and kind of paint a better picture of the benefits that Rakus might have felt by using the plant, and it may explain why the wound didn't show any signs of infection. The other strength is that, or the other thing that I put as a strength, was that the study was purely observational with no interaction between Rakus and the researchers, and this seems to be in line with the ethical guidelines, as there was really no need to interact with him, and especially considering that orangutans are endangered. Some of the limitations is that it was a sample size of one. The researchers only looked at Rakus. They did not observe any other orangutans performing wound care to themselves. The other big limitation is that there are no photos or videos of Rakus applying the plant juice or the plant pulp to his wound. We have those progression photos that I showed you a couple slides prior, but we don't actually have any photo or video evidence that Rakus did what he did with the plant and applying it to his wound. And then there is no comparative data. This is kind of the first of its kind in orangutans. We have similar studies in other great apes, kind of similar studies, but this is a first in orangutans. So we don't have any data to compare it to in orangutans. Now for a comparison and contrast of similar results. Like I said, there are no other orangutan studies looking at wound care, so the closest study I could find is a Clark et al. 2021 study that looked at chimps. The Laumer et al. Study had a sample size of 1, whereas the Clark et al. Study had a sample size of 256 chimps. Neither study had any photos or videos of wound treatment taking place, which I found very interesting. One similarity between the two studies is that both of the groups, so Rakus and the orangutans, performed some kind of wound care, but the treatment was different between the two groups. So like, for instance, the Laumer et al. Study, we talked about Rakus applying the plant juice and the plant pulp topically to his wound. In the Clark et al. Study, with the chimps, their wound treatment consisted of something called leaf dabbing, which is where they take a leaf and topically apply dab the leaf to their wound, and then also licking of wounds. Both of those things were seen as treatment in the Clark et al. Study. The other thing I wanted to mention was that in the Laumer et al. Study, the study only mentions Rakus, and he's doing the wound care to himself. There's no mention of any other orangutans assisting in his wound care. In the Clark et al. Study, a theme that I noticed is that the chimps assisted each other. They took part in the wound care. They were performing wound care on each other, and we did not see that in the Laumer et al. Study. And then one other similarity in both of these studies is that both were looking at wild primates and both were purely observational. So some conclusions, final thoughts, takeaways. Rakus appeared to have intentionally performed wound treatment for himself. He only applied the plant juice and the plant pulp to his wound and no other part of his body, which makes the researchers think that he intentionally applied the plant juice and the plant pulp to his facial wound to help promote healing, and this wasn't like an on accident thing. I would love to hear your hypotheses for how Rakus learned this information. I'm going to go over 2 of what they mentioned in the study. And I also um, emailed, I have my own opinion and I emailed the researcher, but I haven't heard anything back. So if I hear anything back between now and, I don't, the end of this discussion, I'll update it in the discussion. So the first hypothesis that the researchers, that the study states, is that Rakus learned the behavior on accident. He might have been feeding on the leaves, had a wound somewhere, and the leaves accidentally brushed up against the wound, and he felt an analgesic effect. And so he could have learned from that experience on accident. Um, the other hypothesis that they mentioned is due to the social nature of orangutans, the treatment could have spread from individual to individual. Um, my personal opinion, which is what I emailed the researcher about, is could he have learned this from his mother? I don't know. I emailed her to get her thoughts, so we will see about that. These are my graphics cited, and these are my references. Thank you for watching. Let me know if you have any questions. Thank you.